Cool. All right, so next we're going to take the same approach and we'll talk how to actually administrate it into different areas in the body. So what we're looking for? We're looking for a muscle or an area that is tight, in spasm or tension, and we're trying to position that area in a released position. So let's say we have the scalenes here, okay? So the scalenes, I'll help you in how to find the position release. What the scalene does is side bend. That's exactly the position you put the head. So actually it's the muscle action that you put the head there. Then when the muscle is relaxed, then you're massaging that area. Yeah? For here. And then once in a while, so actually it's a finger kneading. And it's a lot easier to go into that scalene muscles when they're relaxed. Then once in a while, you can stretch the scalenes. Again, be aware that I'm dragging the head. I'm not lifting the head. Yeah? And then again, and it's interesting because when I do that, I feel the muscle is still not relaxed. Why? It kind of does that. It's almost contracting but letting go. It's nothing that the client would be aware of it. It's just the state of the tone of the muscle. Even a bit of. Yeah? And yes, I don't have a lot of space, but I just put it in a position that is released, and then I can massage into that area, increasing blood circulation, relaxing, convincing the brain that there can be relaxation into that area. Okay. Next one is the neck erectus spinae. So again, what is the neck erectus spinae does? Which action it does? Extension, right? So you put the neck in a little bit of extension and you keep it there, and then you're massaging that muscle. How do I know that there is an extension? Look at the neck. Look at the, chin. Do you see the chin? So this is a stretch one. Relax, relax. Yeah, good. This is an extension. The chin goes up. Not a lot. Don't do that movement quite aggressively, only a little bit. And then, so it's very similar to normal massage, but you put the body in the neck into a released position of ease that you can massage. Okay. Now, let's look at, say, a muscle like a deltoid. Okay. So, what is the action of the deltoid? Abduction. So you need to take that into an abduction, and then you feel how the muscle would be relaxed from here. So this is normal position. This is a positional release position, and you feel that the muscle is a lot looser. And then you can have the two fingers kind of going across the other way. You can do a little bit of traction even. So I push that position. So do you remember the 3 points of holding their arm? You know, 1, 2, 3. And then from there, you have a wonderful support to work with. Yeah, good. The trapezius, you can work from here. Because again, it's a position of release now. It's the opposite of lowering. This is what the trapezius does. Yeah? Coming into the, I'll take the chair for a second. Coming on to the Biceps, yeah, the position of release would be flexion. If you want to work on the flexors of the forearms, you need to flex here, and then this is the position of release. It's the opposite of the stretching. You can even feeling that this, I can feel the muscle get very tight. This one is getting relaxed, and it's a lot easier to work onto this muscle when it's relaxed. If you want to work on the extensors, extend, do the same action of the muscle, but you do it, then this muscle would be in a position of release. Yeah? So same approach, just a little bit different. Put the muscle in a position of release and then work it. It's just another layer of your learning. It's not that the petrosage is different. I do petrosage, but in a position. Yeah? And you can even do it more after. You know? Just play with it. Let it go. Don't, you know, learn a technique and then break it into something new that you can do. Yeah? Even just, it's really limitless, you know. Very short, I want you to practice it, yeah? So go back and